Imagine having to change your underwear, like 3 times a day, because of just sudden, uncontrollable moisture.
Mhm.
And then barely a week later, experiencing such severe friction that simply walking around or sitting down feels like you have sandpaper in your jeans.
Oh, it's brutal.
Your body is just suddenly as dry as a desert. And this week-to-week whiplash isn't some rare exotic disease, you know? For millions of women, it's honestly just a Tuesday in early perimenopause.
Yeah, the contrast between what we're told to expect and what actually happens is, well, it's staggering.
Right.
We're handed this cultural narrative of like a gentle sunset on our reproductive years,
Well,
a slow, peaceful fading out of hormones.
the reality is not that.
No, not at all. The reality of that transition leaves so many people feeling completely blindsided, isolated, and frankly terrified when their body just stops following its own rules.
Which is exactly why we're pulling apart this topic today. Welcome to the deep dive, everyone.
Welcome.
We've got a massive stack of medical guidelines, clinical studies, and women's health resources today. And our mission is to decode a really specific, really confusing phenomenon.
It is so confusing for people.
It really is. We're looking at how the intense, erratic hormonal fluctuations of the early perimenopausal transition cause this bizarre week-to-week whiplash in vaginal moisture volumes.
Because going from feeling totally normal to sudden floods of moisture to severe painful dryness just days later, I mean, it can make you feel like you're losing your mind.
Oh, absolutely.
But these changes are actually driven by very specific, well-documented biological mechanisms.
Which is the good news.
Exactly. We can completely unpack them, map them out, and understand the microscopic chaos happening behind the scenes today.
Okay, so if the body is supposedly just slowly shutting down this reproductive factory, why is it suddenly producing these massive swings? Like, who is actually in charge of the system, and where is the breakdown happening?
Right, so the breakdown is happening in the communication loop between the brain and the ovaries. To understand why your day-to-day experience is fluctuating so wildly, we really need the baseline of how this system operates.
So take us back to the baseline.
Well, when a person with ovaries is born, they have about 2 million eggs, and
Yeah.
that is their entire lifetime supply.
2 million.
Yeah, but by the time they reach age 40, only about 3% of that original ovarian reserve actually remains.
Wait, just 3%? That is a massive drop-off just to hit age 40. The supply is critically low.
It is. And the brain is highly aware of this low supply.
The brain knows.
The brain knows, yeah. It communicates with the ovaries using a chemical messenger called follicle-stimulating hormone, or FSH.
Okay, FSH.
So in a younger system, the brain sends a moderate, polite FSH signal. The ovary prepares an egg. The hormones rise and fall in a predictable rhythm, and everything is synchronized.
Right, everything works smoothly.
But when that reserve drops to 3%, those remaining ovaries become stubborn. They're just less responsive. So the brain basically starts shouting. It pumps out significantly higher levels of FSH to just force those few remaining eggs into action.
Okay, wait, I want to push back on that logic for a second, though.
Sure.
Because if the system is running out of eggs and we're approaching the menopausal finish line, shouldn't our estrogen levels just quietly trend downward?
You would think so.
Right, like how are we getting massive chaotic surges if the factory is basically closing its doors?
Well, the screaming brain is actually what ruins the quiet shutdown.
Oh, wow.
Yeah, that incredibly high level of FSH triggers a phenomenon called a LOP.
Hello.
LOP, yeah. It stands for luteal out-of-phase event. Because the brain is pumping out so much stimulating hormones so aggressively, a new follicle, a new egg, starts developing way too early.
Okay.
In a lot of cases, it starts growing before the previous menstrual cycle is even finished.
Matt, it sounds like a broken traffic light. Like the go signal just gets stuck on green, and the next wave of traffic plows into the intersection before the last wave of cars has cleared out.
That is exactly it.
You just end up with a biological traffic jam.
And when those biological cars pile up in the intersection, researchers actually call it estrogen stacking.
Estrogen stacking.
Right. So the previous cycle is still finishing up and producing some hormones, but this new early arriving follicle starts pumping out its own estradiol.
And estradiol is the heavy hitter, right?
Exactly. Estradiol is the most potent, heavyweight form of estrogen your body makes. So now you have these massive overlapping surges of heavyweight estrogen just flooding your system completely out of sync.
And looking at the stack of research we pulled, this isn't just a rare glitch for a handful of people either.
No, not at all. One of the clinical studies we reviewed found that 37% of all ovulatory cycles during the early and late menopausal transition exhibited this specific LOP pattern.
37%. That's huge.
Over a third of the time, the engine is completely misfiring.
Right.
And this results in a chaotic rhythm that causes immense psychological whiplash. You might have a really short cycle one month because an egg was forced out too early. And then the very next month, you might have a long anovulatory cycle, meaning no egg is released at all, which can drag on for like 60 anxious days.
So the engine is basically alternating between revving completely out of control, flooding the engine, and then just stalling out in the driveway.
Yes, exactly.
So how does this engine trouble actually translate to the confusing weekly shifts in vaginal moisture? Let's connect that estrogen stacking to the underwear changing scenario we talked about earlier.
Well, estrogen, specifically estradiol, is the primary maintenance hormone for the vagina. It acts as the master regulator.
Okay.
It's responsible for keeping the vaginal tissues thick, elastic, and stimulating your natural, healthy lubrication.
So the general rule is basically high estrogen equals high moisture.
Exactly. High estrogen, high moisture.
Which brings us to the flood stage of the whiplash. If someone is experiencing that LOP cycle where the signals overlap and the estradiol stacks on top of itself.
They're getting hit with a double dose of that master regulator.
Right, and that double dose manifests as what?
It manifests as a sudden, totally excessive surge of watery or milky discharge.
Wow.
Yeah, and it can be incredibly disorienting in your 40s.
Yeah.
I mean, you're culturally primed to expect things to start drying out as you age, right?
Yeah, absolutely.
And instead, you're dealing with this heavy, watery discharge that feels like it came completely out of the blue.
But then the pendulum swings violently in the opposite direction, right? The engine stalls out and you hit the drought.
Right. When the engine stalls, you get an anovulatory cycle.
Meaning no egg.
Exactly. The body tries to release an egg, but the stubborn ovaries just fail to produce one. And because there is no successful ovulation, there is no strong estrogen surge.
Oh, I see.
And without that surge of estradiol, the body produces virtually no cervical mucus. The moisture production just simply shuts down.
It is literally like having a totally broken weather forecast on your phone. Like you check the app, you prepare for a thunderstorm, and you step outside into a bone-dry desert.
It's a perfect way to describe it.
And what really strikes me is how terrifying this mid-cycle drought must be for someone who, tracks their cycle.
Oh, absolutely.
Because if you're used to reading your cervical mucus, a sudden lack of moisture right when you expect it most would set off major alarm bells.
But yeah, for decades, you might be conditioned to seeing clear, slippery, egg-white discharge right around the middle of your cycle.
Right, the classic signs.
Like a biological sign of fertility, of ovulation.
Yeah.
But during early perimenopause, because the brain and ovaries are misfiring, you might go looking for that natural lubrication and instead find severe, unexpected, sometimes painful dryness right during your usual ovulation window.
It just throws everything you've ever learned about your own body right out the window.
It really does.
But the sources highlight something even more intense about these week-to-week moisture shifts. Like, this isn't just a bad week or a temporary annoyance.
Well, it's deeper than that.
The extreme hormonal drops are fundamentally changing the microscopic environment, the actual cellular landscape of the vagina.
Yeah. The clinical term for this structural breakdown is genitourinary syndrome of menopause, or GSM.
Okay, let me stop you right there, though. Because I look at a term like genitourinary syndrome of menopause, and I have to ask, isn't this just natural aging?
Yeah.
Why does the medical community pathologize a natural transition with a scary clinical syndrome name? It honestly feels like we're turning getting older into a disease.
That a very common, very understandable reaction, honestly.
Yeah.
But the medical community gave it a specific name because historically, the suffering associated with these symptoms was completely dismissed by doctors as just, well, getting older.
Right, just deal with it.
Exactly, as if women just had to grit their teeth and bear it. GSM affects anywhere from 50 to 84% of postmenopausal women.
84%, wow.
Yet, because of that stigma, only about 50% ever actually seek treatment.
That's heartbreaking.
It is. So giving it a clinical name validates the physical reality of the cellular breakdown. It tells patients this is a recognized, treatable medical condition, not a personal failing, and you don't have to live in pain.
I like that. Putting a name to it makes it actionable.
Yes.
So let's look at the biology of GSM. What does a healthy premenopausal vagina actually look like at the cellular level before this breakdown happens?
Okay, think of a healthy vaginal environment like a thriving microscopic coral reef.
Okay, I love a good coral reef analogy.
Right, so in this reef, estrogen is the sunlight.
Got it.
When the sunlight is shining, the reef is incredibly active. The superficial epithelial cells, which are the cells lining the surface of the tissue, they shed naturally every 4 hours.
Wait, every 4 hours?
Every 4 hours.
That is a massive amount of cellular turnover happening constantly in the background.
It's constant. And as those surface cells shed, they release a complex sugar called glycogen.
Okay.
In our coral reef analogy, the glycogen is the algae.
Sunlight, algae, got it.
And that algae provides an endless food source for a protective strain of bacteria called lactobacilli.
Okay.
The lactobacilli are the fish that keep the reef clean, and as they eat the glycogen, they produce lactic acid.
Ah, acid.
Exactly. That lactic acid is what keeps the vaginal pH highly acidic, usually hovering somewhere between 3.5 and 5.0.
So the acidic environment is basically the defense mechanism. It's the shield that fights off bad bacteria, yeast, and prevents urinary tract infections.
Spot on.
The sunlight feeds the algae feeds the fish, and the fish protect the reef. But what happens during GSM when those erratic perimenopausal cycles cause the estrogen to just plummet?
Well, when the estrogen drops, the sunlight goes out,
No.
and the entire reef bleaches and starves.
Wow.
The vaginal mucosa, the tissue itself, drastically thins out. Those superficial cells that used to shed and provide food every 4 hours, they drop to less than 10% of the total tissue volume.
So the cellular turnover essentially grinds to a halt.
Completely.
Mm-hmm.
And without those shedding cells, the glycogen vanishes. The protective lactobacilli literally starve to death.
The fish die.
The fish die. And without those good bacteria producing lactic acid, the vaginal pH rises above 5. It becomes much more alkaline.
Which means the acid shield is completely gone, leaving the whole environment completely vulnerable.
Exactly. And the physical results of this microscopic starvation are profound. The tissues lose their elasticity and their collagen.
Mm-hmm.
The natural vaginal folds, which are called rugae, actually flatten out and disappear.
Really?
Yeah, the tissue becomes smooth, pale, and what clinicians call friable.
Okay, I read that word in the sources and it stopped me in my tracks. Friable.
A harsh word.
Yeah, meaning the tissue can easily tear, chafe, and bleed.
Yes. The structural integrity of the tissue is so compromised, so lacking in blood flow, that even gentle, everyday friction causes micro tears.
So we aren't just talking about intimacy here.
No, not at all.
We're talking about the sheer dread of sitting on a bicycle seat or just wearing a tight pair of denim jeans or going for a run because the friction is literally tearing your skin.
Yeah.
It goes so far beyond just feeling a little dry.
It alters how you move through the world. And it explains why the week-to-week whiplash we discussed is so disruptive. One week you're dealing with an alkaline flood, and the next you're dealing with friable tissue that bleeds when you wipe.
It's just a nightmare. But knowing that this microscopic breakdown is happening, we have to look at how to actually intervene.
Yes, let's talk solutions.
If the pH is rising and the tissue is tearing, how do you protect your microenvironment when your hormones are acting like a pendulum?
Right.
Because, I mean, if my face is dry, I grab whatever lotion is sitting on my bathroom counter. Why can't I just use whatever random cheap lubricant is on sale at the drugstore?
Okay, the pH breakdown makes grabbing a random product incredibly dangerous, actually. Yeah. If your vaginal pH is already struggling, already too alkaline, and completely devoid of those protective lactobacilli, introducing a harsh chemical can trigger an immediate severe infection.
Oh, wow.
Which brings us to the specific, evidence-based tiers of treatment the guidelines recommend.
Okay, lay them out for us.
Tier 1 is lubricants.
Okay, so lubricants are the short-term, immediate fix for friction.
Right. Lubricants are strictly for reducing friction during sexual activity. They just sit on top of the skin. But the medical guidelines are very firm here. You must use high-quality, pH-balanced options. You absolutely want to avoid any products containing glycerin or parabens.
Because glycerin is essentially a sugar, right?
Exactly.
Right.
Putting a sugar like glycerin into a vagina that has no good bacteria to defend it is like, well, it's like throwing a massive feast for yeast and bad pathogens.
Oh, that sounds awful.
It's a guaranteed recipe for an infection.
Okay, so if the drugstore lubricant is just a temporary, potentially risky Band-Aid for sexual activity, what are you supposed to do for the other 23 hours of the day?
Right, you need something else.
You can't just walk around with fragile tearing tissue while you go to work.
No, and that requires moving to tier 2, vaginal moisturizers.
Moisturizers, okay.
This is functionally different from a lubricant. Moisturizers are designed for regular, ongoing maintenance. They're meant to be used at least twice a week, completely regardless of whether you're having sex.
So it's much closer to a daily skincare routine, like applying a hydrating serum to your face to repair the skin barrier.
That's a great comparison. A high-quality moisturizer actually absorbs into the epithelium, that top layer of surface cells we talked about,
Yeah.
and physically changes the fluid content of the tissue.
Okay.
But more importantly, clinical moisturizers are formulated to artificially lower the pH back down.
Oh, nice.
They mimic natural, healthy secretions to make the environment acidic again, acting as like life support for the reef while your natural estrogen is fluctuating.
But what if life support isn't enough? Like, if the tissue is already friable, tearing, and bleeding, putting moisturizer on it feels like putting oil on the gears of an engine that's already cracked.
Hmm.
Sometimes you need to fix the actual engine.
That's very true. When the structural damage is that severe, the guidelines recommend Tier 3, local vaginal estrogen.
Okay.
And it is vital to differentiate this from systemic hormone replacement therapy, or HRT.
Right. That's an important distinction.
Systemic HRT is a pill or a patch that sends hormones circulating through your entire bloodstream to treat hot flashes and full-body symptoms. Local vaginal estrogen is a very low-dose, highly targeted treatment.
So it comes in like a cream or a tiny dissolvable tablet or a flexible ring, and it just stays right there in the vaginal tissue.
Exactly. The systemic absorption into the rest of your body is incredibly minimal.
Good to know.
But locally, right at the site of the tissue, it acts as a total biological reset. It wakes up those dormant superficial cells. It physically thickens the tissue back up, restores the vital blood flow, brings the natural rugae folds back, and crucially, it drives the pH safely back below 5.
It literally turns the sunlight back on for the coral reef.
Yes, it restores the entire ecosystem, and the clinical data shows that restoring this acidic environment significantly reduces the risk of recurrent urinary tract infections.
Which is huge.
It's a massive, often completely overlooked quality of life issue for women navigating this stage.
It's really amazing how effective and targeted the relief can be when you actually understand the underlying biology.
It really is.
Looking back at the whole picture we've mapped out today, we started with the engine, the brain screaming with high FSH, trying to force a 3% ovarian reserve to keep working, which triggers those chaotic overlapping LOP cycles,
And those early firing follicles create the estrogen stacking.
which directly causes the weekly whiplash. You get the unpredictable watery floods from the stacked estradiol, followed immediately by sudden severe ovulation dryness when the engine stalls out.
Exactly.
And if left unchecked, that hormonal roller coaster leads to the cellular starvation of GSM, the thinning, friable tissue, the loss of good bacteria, and the rising pH.
But the ultimate takeaway for you listening is that this breakdown is entirely treatable.
Yes, that is the most important part.
By understanding the biology of the tissue, you can move from pH-balanced lubricants to cellular moisturizers to localized estrogen. You have the medical tools to restore the balance, lower the pH, and heal the microenvironment.
Understanding this hidden biology is the key to not feeling crazy or broken when your body stops following the rules it's played by for decades.
Exactly. You are not broken.
I want to leave you with one final thing to ponder, though.
Oh, let's hear it.
In our 20s and 30s, society teaches us to obsessively track our cycles, right? We track our periods and our cervical mucus, usually to either prevent a pregnancy or plan for one. We're conditioned to treat our reproductive output as the only metric that matters.
Wow.
But what if tracking the seemingly random, chaotic shifts in vaginal moisture in our 40s is actually the ultimate unfiltered window into the changing connection between our brain and our biology?
I love that perspective.
It's a vital, real-time health metric that we are culturally trained to completely ignore. Maybe it's time we start paying close attention to the weather forecast, even when the seasons are changing. Thanks for diving deep with us.